Hello, my name is Dr. Fred Sylvester from New Hanover Chiropractic, and today we have an esteemed guest, a rheumatologist in Pottstown, Dr. Tahir. Welcome.
Thank you, Dr. Sylvester. Thank you for having me over. It's a pleasure to see you and your practice and your members of your practice.
Why, thank you.
Delighted to be here.
So Dr. Tahir graduated from Michigan and then did his residency at NYU. He's been practicing for roughly about 14, 15 years, and he's been in the Pottstown area, I think, for about
3 years now.
Yeah,
about 3 years, and it's been a delightful change in my career to join Pottstown Medical Specialist, the PMSI group, and getting to know doctors, the community. I've been welcomed here, loved here, and I'm enjoying my time. Yes.
Well, your reputation precedes yourself.
Thank you.
So today we're going to talk about some autoimmune diseases such as rheumatoid, and there's a couple of things that sit underneath that umbrella: rheumatoid, lupus, psoriatic. But today we're going to focus a little bit more on rheumatoid arthritis to give our viewing population some information on that. So if they were ever considering or had a diagnosis or a condition like that, where to turn to. So what is?
Yeah, most of the patients, when they come to us and they know about their immune system, which is our body's defense against infections, even cancers. But sometimes because of different conditions in the body, infections, imbalance in our gut microbiome, genetic factors, smoking, it can trigger our immune cells against our own body proteins.
Okay.
And that denaturing process can happen from various insults in the body. But primarily things that I just mentioned. Inflammation is created as a result of those immune cells targeting our own proteins, and then lead to more and more inflammatory cytokines, or the chemicals that lead to development of inflammation in the body. And now it's circulating in our blood, and for some reasons, the proteins that our body starts making antibodies against match the proteins of our synovium, our skin, and they start targeting them. As a result of this invasion of our own body's armies, to say, against our own cells, would create body to show some signs of inflammation, which is swelling, pain, tenderness, loss of function. And that's when we see signs and patterns of autoimmunity to develop. Most doctors patients come to me and they say, "Oh, you are a rheumatoid doctor," because they think autoimmunity and rheumatoid is kind of the same, and that's true. It's the prototypical disease of autoimmunity. Lupus is another big disease that we see, and it's basically our body's immune system activating against, misdirected towards our body proteins.
So what is the prevalence when you're starting to look at, we'll say across the United States, of rheumatoid in general?
Yeah, so if you look at different studies, they would say somewhere between 0.5 to 1% of the population. I believe that for the last 20 years I've been in this field of autoimmunity. I feel like it's on the rise. Newer data would show that it is on the rise because of, I think, rise of processed food and more stressful life that we are carrying. Because those, I believe, are the biggest triggers that turn our body into more inflammatory, predisposed to inflammatory conditions and autoimmunity. But as far as right now, we think that there are about 1 to 2 million people living with rheumatoid arthritis. Some studies would say even higher, 3%. But to me, I think different variations of disease exist. Some people are full-blown rheumatoid arthritis, and some people are preclinical stage. They're not fully diagnosable as rheumatoid, but they're heading towards that. So there's a preclinical rheumatoid arthritis that sometimes we see that could be intervened also. And they are, of course, not put in that data.
Yeah, for sure.
So I think the prevalence is a little bit higher.
Higher than what it commonly is. Who does it affect mostly? Is it mostly males, females? Is it a specific age that we should be looking at this at?
Yeah, so disease, rheumatoid, overall autoimmunity is more prevalent in women. Rheumatoid arthritis is not as imbalanced as lupus. So, but if you say it is about 2 times more common in women, and we see peaks of rheumatoid arthritis in age group between 30 to 40 women of age group, and then we have a second peak of incidence in 60s, late onset rheumatoid arthritis, which is also common in females. But I have to say that with certain predisposed individuals with family history, you would see that commonly also seen in males. But by and large, a lot more common in females, almost double the incidence.
So if a person was concerned that they had, rheumatoid, or the condition was there, I know you talked about, different things that are going on the biochemistry and the physiology. But what would they look like? What would they be concerned with?
Yeah. So I tell them that there is a pattern to autoimmunity, and rheumatoid arthritis is our best example. It starts with our small joints of our hands. So our knuckles, and sometimes people come and they have these distal joints, the distal interphalangeal joints, knobby and bony. That's osteoarthritis.
Okay.
But when we're looking at our hand and we are looking at the MCP joints, which are the joints where we see swelling, and the PIP joints, are the small joints that start getting inflamed, swollen and pain and tender. And they're kind of symmetric, meaning mirror image to each other. You would see that a person would have both hands swollen, both wrists swollen, both elbows swollen, and it's a symmetric pattern that would then add more and more joints.
Okay.
But to answer your question, small joints of hands and feet is the most typical presentation that we would see.
Okay.
But if you have a long-standing untreated rheumatoid arthritis, you could be having flares in almost every joint of your body, even our spine, the cervical spine or the neck joint.
Gotcha.
Yeah.
So if a person suspected rheumatoid and they came to your office for your evaluation and management, what could they expect?
Yeah, so I tell them that, the first visit is like your visit zero. I'm trying to understand what is really going on. So do you have, most people come when they have pain. Some people are very cautious about their body, so they'll come with joint pain, in addition to if they notice swelling, stiffness. So I'll sit down with them and I'll get the history. Because any chronic autoimmune disease has at least to be present about 6 weeks or more for it to be called a chronic disease.
Okay.
So you can have an acute incidence of arthritis for less than 2 weeks, 3 weeks, and you wait and see maybe it will go away. Like sudden infections can trigger it, like parvovirus is one of the examples, and would disappear. But you want to wait until 6 to 12 weeks have passed through and the persistent symptoms are there. It doesn't mean you don't need to be treated, but the pattern of the history as example is important. Number 2 is, does it lead to joint pain? Do you have morning stiffness? Do you have loss of function? And is it causing fatigue? Because it's a systemic disease with a lot of inflammation built up in the body. So people sometimes come and they say, my joints hurt, but I'm so fatigued. And it just consumes your energy and decreases your energy production. So that's what I asked them in the history. I would also ask about their family history, because a lot of times we have patients who have autoimmunity in their family and they would be more predisposed to it. History of recent infections can cause more triggers and more risks of it. So history, physical examination, then we go to lab testing.
Yes.
Everybody knows about rheumatoid factor, which is it is predominantly seen in rheumatoid arthritis, but other diseases can cause it too. So like cancers or hepatitis C can give you a positive rheumatoid factor. So we have a more specific marker in the blood called anti-CCP antibodies. And they are denatured proteins in the blood that can be specific for rheumatoid arthritis. Previously, we used to think they are only present in rheumatoid arthritis, but now studies show that you can also see it in psoriatic arthritis. But by and large, this is one of the most specific marker for rheumatoid arthritis. Now, in the last 5 years, there's been some additional testing that has found that, because we do miss some patients who have negative rheumatoid factor, negative CCP antibodies, but they still have rheumatoid arthritis by the picture, by the history. So there's few novel testing that you can order through a rheumatologist and get them tested. We look for inflammatory markers. When you come to a rheumatologist, almost every patient knows that it's almost like they drain your blood and like, I've been feeling sick and you're draining my blood, because we want to check for all the other mimickers of the disease. So we are looking at lupus-like antibodies, lupus-related diseases. We're looking for uric acid levels, because in some patients you could present as pseudo-RA from your gout if you have a polyarticular gout. So yeah, the blood work would be extensive.
For sure.
So I tell patients, go hydrated, and so that you don't feel really tired after taking the blood. We analyze that blood after when they come for follow-up visit. X-ray and imaging is important too. X-rays, I have to say that you can't, if the patient is just 6 months into the disease, you're not probably gonna see rheumatoid changes,
Okay.
but by 1 to 2 years, you can start seeing changes. So that's why that window of opportunity. So if you see within 1 to 2 years and you get into the right treatment, you can prevent the joint damage. So I hope that I never see patients with radiologic evidence of rheumatoid arthritis at this day and age.
I got you.
But MRI is much more sensitive. So sometimes if we are not sure if our treatment is effective or we're not sure if the diagnosis is correct, we will go for an MRI as well. So those are basic markers of our workup.
Yes.
Differential diagnosis is something that we also keep in mind. So pattern of the disease. So you can, if you have a rash with arthritis that looks like rheumatoid, it could be psoriatic arthritis.
Sure.
If you have a lot of spinal stiffness, it could be ankylosing spondylitis that you can have joint pains.
Yeah.
So then that's going through our mind all the time.
Yeah, you're definitely
I think as rheumatologists, we tend to go back to our thought process. Okay, could this be a mimicker of that disease, and we always constantly trying to make sure we are on the right path. And that's how they should expect that.
So there's two questions that are going to come out to you all at one time. The first one is that treatment, but I would have to say early intervention treatment is probably essential too. So how does treatment look?
So I like how you put it, early intervention, and I think that we know that early intervention for health screening is important, right? We know that cancer screening is important, and so is autoimmunity, because underlying sometimes you're just seeing the tip of the iceberg.
Yes.
The inflammatory cytokines, they are like a tsunami of inflammation in your blood, and if you don't treat it, don't address it, it's going to lead to internal organ damage, cardiovascular disease, lung involvement, kidney involvement. So you want to
much more extensive than just
much more
joints.
expensive than joints,
Right.
yeah, because these are systemic diseases, and their burden on your health is much higher than just your skin and joints. Although in field of physical medicine that people really value their functionality and pain, and that's why they come to you, that's why they come to me. But what I try to tell them is that your joint is damaging and it's just on the surface. Internal damage is a lot more important and equally important, so we need to make sure you treat early.
For sure.
And so there is always a concept, a debate. Before I came here, I had a patient, and we've been talking about, she's a seropositive rheumatoid arthritis, a middle-aged 45-ish year-old lady that I've been seeing for almost a year, and she has presented with inflammatory markers of about 16, which is double the amount of normal. And over the last 1 year, today we just had a conversation, her inflammatory markers is 26. So it's almost now 3 times the limit of normal over that. And we've been having this debate of adding biologic therapy, and for some reason she's uncomfortable about it.
For sure.
So I tell her, look, I try to give them an example, if you have a very high cholesterol, like your triglycerides are 300, and your total cholesterol is like 280, right? And your PCP is trying to tell you to go to cholesterol, try to take a statin, right? And you are at that age group, have been 40 and 50, you don't address it. Where is that cholesterol gonna go? It's going to deposit in your arteries. It's going to cause increased risk of cardiovascular disease, strokes, MIs, peripheral vascular disease. The same way, rheumatoid arthritis, lupus, these autoimmune diseases, if you are not going to address it, where is it going to cause the damages on you? And sometimes it's irreversible.
Right.
And so because the newer therapy and early intervention is important, because methotrexate has been around for over 50 years. It's a toxic drug. It can cause problems, but it helps bridge us to newer therapies safely and keep the newer therapy more effective, because it reduces the same immune response can make your medications ineffective, and methotrexate can help you prolong the effectiveness of your newer novel biologic agents.
For sure.
So today we had this heart-to-heart discussion with this patient, and I said, look, I want you to know that this increased inflammatory markers are showing signs of damage to your body.
Right.
I then start talking about their metabolic health. It's highly related to your cardiovascular health. 50 times,
Wow.
50, so double the incidence of cardiovascular disease of an untreated rheumatoid arthritis.
Wow.
So yeah, it's 2 years, within 1 to 2 years, you need to get the disease under control, put it into remission, and then we can back off
Sure.
on the treatment. A lot of people are like, am I gonna be on the medicine forever? I said, I hope not.
Right.
Because we reset your immune system to tolerate and improve lifestyle changes, make sure that you can actually go back to your life and having to need less medicines over time.
That takes us right into one of our last questions that we're looking at here, is that what can people do in conjunction with your clinical management from a self-help standpoint? We were talking about earlier about, gut biomes and health and how we eat and exercise, and American College Rheumatology recommends X amount of minutes per week to be active. So what can people do from a supplement standpoint?
It's one of my
else?
favorite topics to talk about it, and I know you are very passionate about that too, and education about patients. So the source of inflammation that entered in your body has to come from somewhere, right? If you're not inhaling it. So people who live near highways and smoking areas or work in factories, they do have higher incidence of rheumatoid arthritis. So toxins produce increased risk of autoimmunity. But if you're not a smoker, you don't have family history, the source of that protein that triggers your immune system to recognize it, it's coming from your gut. So gut is an imbalance of your gut microbiome. So we have about 300 trillion microbacteria living in our gut, several times higher than our own original human cells.
Sure.
And they contribute to our better health, our longevity, and they educate our immune system how to react into certain situations.
Sure.
Now, if we've been eating processed food, unhealthy snacking, they lead to imbalance of the gut microbiome. And now the unhealthy bacteria take over the role of balancing and educating our immune system, and they make our immune system turn against our own body proteins, as you said, the synovium and our blood vessels. So now our immune cells are being triggered by imbalanced microbiome. So going back to the basics of if it's come from the earth, from land, if it comes from the sea, it is an animal or a meat that you eat that has been raised without chemicals. Yeah. It's okay for our human consumption. But when we go and eat extra amount of processed food and fast foods, and we keep eating it every day, it's gonna cause imbalance of our gut microbiome and spillover. So we have a condition called molecular mimicry, where the proteins of cells are triggering our immune system to go against it. It also leads to hyperactivation of immune cells. We have largest amount of immune cells in our gut, other than our big organs like spleen and liver and lymph nodes. So that all leads to an imbalance of inflammation, and that seeps through your gut into your blood vessels. There's a condition in naturopathic literature called leaky gut or gut dysbiosis, intestinal permeability. And I talked to patients about that. I said, there is 4 R's of repair mechanism that you can do, getting rid of the harmful medicines that can cause it. Even medicines that I prescribe, I tell patients, you have to reduce the use of NSAIDs, prednisone, excessive use of antibiotics, and even the acid suppression medicines, like PPIs, because they cause imbalance of our gut microbiome.
For sure, absolutely.
But adding pre and probiotics through diet is important, and there are list of things that people can read about and discuss with their doctors, where they can get great sources of pre and probiotics, and increasing amount of fiber so that they can heal their gut. Other things I tell patients, look, there are 4 quadrants of your health that should always be in your mind, and I will try to focus on it every time you come in, or maybe we can talk about one of them. First is your mental and your cognitive health. So make sure you stay positive-minded. Make sure that this arthritis or inflammation, autoimmunity is not causing you to trigger into depression. because
Sure.
that's also a major culprit. Number two, always try to learn something new every day, no matter what age you are. Learn and improve your life every time, because every day you can learn something new, and that will keep your brain young.
Sure.
Your physical health is important as you educate your people and you train them to get back to your life through your chiropractor practice. Physical ability, making sure you keep yourself active. Take care of your vital organs, your heart, your lungs, your kidneys, your gut health. And the last thing is metabolic health and hormonal health.
Wow.
Make sure that you are not gradually taking yourself to become a metabolic syndrome patients, like pre-diabetes.
Sure.
Adiposity or excessive obesity triggers inflammation.
Sure.
I tell patients excessive amount of abnormal, unhealthy body fat on your viscera is a reservoir for inflammation and triggering your autoimmunity. And last thing is hormonal health. As we get older, we need to make sure that our vital four major or hormonal health are good, like thyroid, parathyroid, our sexual health hormones. So all of this combined together, having that kind of concept, like cherish and your body, take care of it actively, and then your doctors will actually be able to help you even more, because you're more interested in taking care of you.
So this will be for a whole nother topic, but like blue zones, I don't know if you're familiar with them, but blue zones around the earth, Okinawa, down in Chile, and that type of stuff, where people have lots of longevity and that type of stuff, and we will have another show on that sometime later.
Yes.
But what is your take-home message?
Well, I think that as we were talking about it, don't minimize your autoimmunity, your inflammation. Pay attention to your physical abilities. Go work out on a regular basis so that you can see how your body is maintaining itself, staying to keep young. Make sure that you have at least 30 minutes a day of workout. Eat healthy, natural foods, whole foods. Okay. Make sure that if you need any help with your mental health, you seek help sooner than later.
For sure.
Stay positive minded, and as you get older, don't accept age as a number that can take away youthfulness from you. No, you can continue to stay and feel young if you take care of your health.
Wonderful. Thank you very much, Dr. Tahir. It's been a pleasure.
Right.
A lot of great information. Our viewing audience cannot come away with this without being a better community.
Thank you.
I appreciate it. Good day and good health.